Hello, everybody. Nice to see you all again after our meeting in Miami. It was a nice time to spend with our colleagues and friends and probably families as well with some good weather. We had a nice panel to look at salivary gland tumor management, really for the community physicians, specifically zeroing in some of the challenges that you may face in your own practices. It was a good way to really review what we know about salivary gland malignancies in terms of the evaluation, history taken, physical exam, really the diagnostic approach with biopsies, imaging, as well as sort of making plans for management, which again entails surgery. Some of the takeaways really to think about this is when you're worried about malignancies is the way they present in patients, some of the changes on the physical exam, the worry signs, as well as looking at the imaging that you may use to evaluate these patients. The key part for this really is to try to use MRI imaging, as that really offers the most information in terms of the characteristics of the lesions and some of the signals that you may actually be able to see. A lot of the MRIs are able to do diffusion-weighted imaging and ADC mapping, which really helps with the density of the lesion and how you may actually be worried about whether this is a malignancy or not. Then this could lead to really the proper biopsies of the areas that are the most dense on the imaging to give you the diagnosis that you may need. The challenges with that, again, are the changes in the way the cytopathologists look at these lesions. The Milan characteristics and Milan grading system for these salivary glands is something that's pretty new, and it has been a challenge, especially for the community cytopathologists, to give us a discrete, a very concrete answer in terms of the diagnostic approach and biopsies from these. So we went over sort of going over the Milan grading system, but also a way to decipher the reports that you may be seeing from your community cytopathologist so that it may be a little easier for you to decipher the information that they're giving to you in terms of their concern for potential malignancies. And in addition to that, really thinking about using that data then to make the appropriate treatment plan, typically again surgery and the extent of surgery, as well as thinking about doing some form of reconstruction in the areas of these surgeries, given the cosmetically sensitive areas for your patients, even in the community practice, something that everybody could do with limited effort. Overall, it was really a nice panel to look at all aspects of a patient that you see in your community practice with a salivary gland tumor and how you really go about examining them, working them up, including getting the appropriate diagnosis and the biopsy results, and then deciphering that results to make sure you make the right treatment decision in terms of surgery as well as potentially other treatments.